Good afternoon. Thank you for joining me for the Primary Care Fund Annual Application Review for fiscal year 23. My name is Tracy Gonzalez with the Department of Healthcare Policy and Financing, and I'll be your point of contact for the Primary Care Fund program. Today, we'll be going over the SharePoint platform, application overview, data validation updates, and primary care fund funding. So many of our returning applicants are familiar with the SharePoint platform. SharePoint is an external sharing site, and this is where your applications and supporting documentation are housed, as well as all of your previous applications and supporting documentation. Applications are in Excel format. We do not accept PDF version, and we ask that you not insert or try and attach any documents to the Excel workbook. All supporting documentation should be uploaded separately to the SharePoint platform. The fiscal year 23 applications can be found in your SharePoint profile page under a folder labeled 2022-23. Applications will be due May 20th, and we ask that once you have completed your application and uploaded all of your documents to SharePoint, that you email the department that you have officially submitted your application. Each agency has their own SharePoint profile page, and they must have a registered user to access it. So if you're a new applicant or a returning applicant with staffing changes and need to request user, please email the department with the individual's name that you're requesting access for, their email address, and your organization. An invitation to the SharePoint page will be sent with instructions on how to complete setup. If you don't see the invitation, sometimes they do end up in your spam. And if you have any questions or need help accessing your page, please let me know. I'll be more than happy to help you. One of the first tabs you're going to see in your application is the Applicant Agency Information tab. So this is where you're going to insert the bulk of your agency information. So your agency's legal name, your federal tax ID, the address of your agency, and your point of contacts for the Primary Care Fund program. Also in the upper right-hand corner, you're going to see some check boxes. So the first checkbox is if you are an FQHC. The second checkbox is if you are a partnership or a corporation or other. And the third checkbox is if you have a joint commission or accreditation association for ambulatory healthcare certification or licensure. And you will want to make sure that the duration of the accreditation is clearly stated on the application. Also upload your certificates and just make sure that that expiration date is on the certificate as well. So down on the bottom of this tab is your average cost per visit. Now, the department does not have a set formula for this. We recommend using the Uniform Data System medical cost per medical visit formula. And we have included that in the application as well, in case that is the formula that you choose to use for your average cost per visit. Question 2 in the application pertains to the sliding fee schedule. We do expect a minimum of 2 sliding fee scales and the corresponding copayments for each, covering calendar year 2021 to your freeze date. And because the federal poverty level changes in January, and depending on your freeze date, you could have as many as 3 sliding fee scales. But the important thing to remember is that you must provide sliding fee scales that support the time frame of your application. And even if your scale and copayments have not changed, we still need documentation to support your data. Outside entity requirements. Please ensure that your outside entity is sampling patients counted to your freeze date. The department does require a minimum of 25 patients sampled. Providers that had financial data findings in their fiscal year 21 audit were notified to increase their sample size on February 4th. So if you did have your fiscal year 21 application audited and you're unsure as to whether or not you need to increase your sample size, feel free to contact me and I'd be more than happy to look that information up for you. The department does offer a waiver, and what this waiver does is allow the applicant to only fill out a portion of the application up to question 3. And the current waiver exists if the grantee has been awarded funding within the previous 3 years, if they meet the criteria of a qualified provider, and certify that there has been no changes in their capacity to meet all eligibility requirements. Now, the waiver does not apply if you're a new applicant or if you have been notified that you have to complete the entire application, and notifications were sent to those providers on February 4th. You can expect to fill out the application in its entirety every 3 years. Now, on a side note, the waiver does not include the outside entity portion of the application. So it is the expectation that every applicant complete the outside entity requirement. In August 2020, the Medical Services Board approved the department's request to lift face-to-face restrictions, allowing for all means of telehealth service deliveries. There has been no change to this rule, and patients seen via telehealth may be counted on your application. So this is a link to the frequently asked questions page on the department website. This is a great resource for you, especially as you're filling out this year's application. 9 times out of 10, your questions can be answered just by visiting this link. So I do recommend that you bookmark it and save it as your favorite for future reference. So we'll move into common audit findings. The department is required to conduct annual audits on the primary care fund applications each year. So organizations selected to have their fiscal year 23 applications audited will be notified in the upcoming months. Data validation audits will happen approximately every 3 years. So some of the common findings that surface during the audits are not counting secondary insurances, not charging appropriate sliding fee scale copays, counting self-pay patients, and not keeping documentation to support your application, which includes patient counts, your FPL, and charged copays. We do ask that you keep all documentation used to complete your applications for 6 fiscal years. This is very important in case you were to be audited by the department or by the state auditor's office. You want to make sure that you have that documentation handy and ready. You don't want to try and recreate it, because that's where common errors end up happening, and errors can lead to findings in an audit. So just very important to make sure that you keep that information used in your application for 6 fiscal years. It's also important to know the definition of a medically indigent patient. A medically indigent patient is a patient whose yearly family income is below 200% of the FPL. A patient who is not eligible for Medicaid, CHP+, Medicare, or any other governmental reimbursement for healthcare costs, and where there is no third-party payer. Self-pay patients, in order to meet the qualifications of a primary care fund provider, our regulations are pretty clear. The provider must accept all patients, regardless of their ability to pay, and use the sliding fee scale for payment or not charge the patient at all. The sliding fee scale is a tiered copayment system that determines the level of a participant's financial participation and guarantees that the patient's financial participation is below usual and customary charges. So if a provider is charging patients on a self-pay rate that is outside the provider's sliding fee scale or is not a $0 rate, those patients are not to be included in the final patient count on your application and should be eliminated during the methodology process. Women's Wellness Connection reimburses a limited set of services on a per patient service-specific basis. WWC patients should be categorized on your application under Step 2C. However, if the patient received WWC services and also at that appointment received other comprehensive primary care services, they can be included in your clinic's uninsured count on your application, but only if the patient was charged a sliding fee scale copayment and if the services are distinctly documented in your provider's billing system. The same applies for HRSA COVID-19 uninsured program. So if you are participating in this program and, for example, you have a patient that comes in for a COVID-19 vaccine, but they also receive other comprehensive primary care services at that appointment, they can be included on your clinic's uninsured count if that same criteria is met, that the patient was charged a sliding fee scale copayment and the services are distinctly documented in your billing system. The Ryan White HIV/AIDS program has 4 parts to it. Grant recipients of Part A, Part B, and Part C can include patients in their primary care fund medically indigent patient count, but we will require documentation supporting which part of the Ryan White HIV program had been awarded to you. We will also ask you to identify what type of fundings were received. So both of those pieces of information are going to need to be uploaded to your application to support the Ryan White HIV/AIDS program funding. And Part D of the program is associated with payments for specific patients and services. So patients seen under Part D should be categorized under Step 2C on your application. So that takes us into primary care fund funding. On October 28, 2021, Colorado State Plan Amendment 21-0019 was approved. This allowed for the department to draw down federal matching funds for Medicaid providers. The projected tobacco tax appropriation for fiscal year 23 is $25,351,935. In fiscal year 21, we began paying 95% of the appropriated amount to providers during the Q1 through Q3 payments. And then we true up in the fourth quarter to whatever the final appropriation amount is. This payment structure seems to have been working, as it does help to ensure that payments are received when expected and that the fourth quarter payment isn't so severely impacted. So again, we will continue with this payment structure as it has seemed to be working. So a few reminders. The intent to apply is due to the department on Friday, April 22nd. The application responses are due by close of business on Friday, May 20th. And as a reminder, once you have completed your application and uploaded it to SharePoint, notify the department that you are officially submitting your application. And then tentative award notifications will go out Monday, July 5th. And the final slide has our contact information. So again, my name is Tracy Gonzalez and my email is listed here, as well as the primary care fund email address and the department website. And I just want to remind you that the department website has a lot of good resources on it. It has the FAQ, it has the application timeline, as well as the application itself. So that is a good place for you to visit as you're filling out the fiscal year 23 applications. So again, thank you for joining me. And I very much look forward to working with you in the upcoming year. Have a good day.